Hi, I'm Dr. Rossi. I'm a board-certified dermatologist and dermatologic surgeon. I work at Memorial Sloan Kettering in New York City. And there's not a day that goes by that I don't talk about hair loss with my patients. Hair loss for many patients is not just a cosmetic issue. It's actually a medical problem that affects them psychosocially, emotionally, and in their daily activities of living. We view hair as something cultural, something religious, something that people identify with. Growing up with hairdressing parents and being in a hair salon my whole life, I really know that firsthand how meticulous people are with their hair. And so hair loss for me is not just something cosmetic. It's a disease that dermatologists want to tackle, they want to treat, and they want to improve their patients' quality of life. It's akin to obesity. For many years, people didn't think obesity was a disease. They thought it was more a cosmetic, basically cosmetic issue, but it's not. We know it's a disease. We know it represents something that's going on inside the body as well. And I view hair loss as that. I try to get to a root cause analysis of why this patient's losing their hair and how we can better treat them holistically. There's different causes of hair loss, there's different types of hair loss, but we do know above all that it really affects patients psychosocially. And not only is it something that's going on physically, but emotionally it can really take a toll on patients and even young patients and female patients. And we've seen an uptick of female patients coming in for this. And this is driven by awareness. Back in the day, we didn't have so much awareness of female pattern hair loss. And now that more women are talking about it or describing it, it's really helped to bring this to the forefront, especially for women. And hair loss does affect everyone. We know all ages, males, females, as you heard from Landon and Kelly, 2 different time points in their life, both affected by androgenetic alopecia. What's really amazing is that I'm seeing patients that are highly motivated to tackle their hair loss. And this includes young men who sort of know that they have it coming down the genetic pipeline. They see their parents with hair loss and they know they really need to address this early. As well as now females, which is amazing because they're talking more about hair loss, even though there's a lack of FDA-approved medications for it. They're talking more about it in the chat rooms and they're bringing it up in their consultation. They really want to address their hair thinning and their hair loss, especially around the 30s and 40s. It's really critical for them. And this is something that we want to give options to patients, right? We don't want to just say, hey, there's this only medication that you can take. But if we had more medications that we could actually use in these populations that were safe, efficacious, but also durable, because we know we will have to be treating them for quite some time. And I'm really excited about the future of hair loss and for myself to treat hair loss. That's because ABS-201 represents a completely novel mechanism of action that we can use to help actually tackle hair loss and androgenetic alopecia. It comes at hair loss in a completely new perspective than anything we've had before. And to hear more about the science of ABS-201, the prolactin story, the mechanism of blocking the prolactin receptor, we're going to hear from Andreas Busch, who's going to go over all that amazing research.